What can you do if a patient has a mental health crisis in your treatment room, and this would apply to a GP or anyone else, and you don't want to just kick them out the door and say, we'll go and handle it somewhere else, but at the same time, you've got a whole clinic to look after, as well as looking after the mental health of this patient.
Yeah. Well, I think you did very well to call the ambulance full stop. I think a lot of people kind of almost kind of don't want to take that step. It feels like a big step. I think you've got to follow your judgment there. But I think the main thing to consider is not necessarily around their psychological distress, which can be horrible to witness. Yes. But if you're going to go down that route of emergency services, they're only going to be interested in the risk. So are they openly talking about suicide or a plan to commit suicide? Are they being aggressive to the point where you think they're going to harm someone?
Yes.
And that's probably when you want to go down the emergency services route. Otherwise, I think it's much better to try and go down the family, try and I think the other thing is when people are mentally unwell, it's perfectly ethical to manipulate the situation to try and get a better outcome. So I think if they're really unwell and they're not listening or whatever, I think trying to find a way to get hold of their phone and call a loved one and try and get someone who actually understands the full context of the illness would be the best kind of outcome.
Yes, you raise a point there which will make people nervous, of course. They're thinking, well, I don't have the right to discuss this person's mental health or any other health aspects with someone without their permission. Perhaps this patient isn't in a position to give me that permission or won't want to because they're stressed.
Well, I think you can make it best interest. I mean, I think it's important not to disclose anything that you don't have to, but I think if you're calling and saying that your patient has arrived and you're worried enough that they do need someone that needs support beyond themselves, then I think it's fine to do that. But you don't need to disclose the details of your worries. You just need to say, I'm really worried about their health. I don't have enough context. I need some more support here to help them.
Yeah.